Hi, everyone. My name is Dr. Taylor Soderborg, and I'm the medical director at Tiny Health. In this video, I'm going to be walking you through the gut health report of a woman who is currently 27 weeks pregnant. Checking in while trying to conceive or pregnant is ideal because this can not only optimize mom's health during pregnancy, but it can also increase the likelihood of beneficial seeding during delivery. Baby's microbiome begins teaching the immune system how to behave starting day one. So, increasing the likelihood of optimal seeding in baby is ideal. However, I will caveat that even with all of the boxes checked and all the recommended actions taken, sometimes babies just don't get colonized with ideal bifidobacterium, which is why we recommend checking in early on baby's gut about 1 to 2 weeks old to check in on their gut health and what got colonized. Watch the baby gut health video for more information. So, Tiny Health is a great way to check in on the microbiome because we use a technology called shotgun metagenomics. While tests prior to Tiny Health use something called PCR, shotgun metagenomics is now the gold standard for microbiome research, meaning that you are getting the most up to date insights from the most recent research available with shotgun metagenomics. And we can tell you not only who is in the microbiome at very, very accurate levels, but we can also tell you the function of those microbes because we sequence all of the genetic information of the microbiome. So this means we can tell you who's there and how well they're doing their jobs. And this is important because the adult gut microbiome has a lot of jobs. So if you look down at the very bottom of the report, we can see that there's a microbiome breakdown. And we can see all the species detected down to 0.05% of the microbiome. Now, there's a lot of them, which is great because the adult microbiome is very diverse. But how can we be sure that this collection of microbes are good or if it needs to be adjusted? Well, Tiny Health takes the guesswork out of that by breaking down all of these microbes detected into meaningful categories. So let's review what types of categories and insights we have and which are most important for the adult-like microbiome. Now, I say adult-like because actually we retrieve our adult-like microbiome somewhere between age 3 and 5. And so they certainly aren't adults, but it's an adult-like microbiome. And so in this case, I'm going to be pointing out specifically the adult metrics and those that are important for, especially during pregnancy or while trying to conceive. We do have a child microbiome test, which will provide similar insights, but action specifically for those age groups. Now, given how important it is for the adult microbiome to be diverse, that's one of the first metrics I like to check in on. So if we click into balance and robustness, we can take a peek at the diversity and we can see that it's within high normal range. This is great. Now, it doesn't need any support, but I will tell you that more diversity is always good. But overall, this person's starting from a good spot. Now, next, I like to see if the good things the microbiome should be doing are, in fact, being done well. And so this is one of the powers of shotgun metagenomics, because we can not only see who is there, but what their function is. Now, testing like PCR can really blow opportunistic pathogens or unfriendly bacteria out of proportion. So while it's really important to know if those are high or out of range, it's equally important to know if the good microbes are present at appropriate levels and if they're functioning at the ideal level. And this emphasis both on the beneficial microbes as well as the disruptive microbes, that's something that Tiny Health is able to provide you insight on where other tests don't. So for checking in on the good, I like to first click into the beneficial microbes. Here we can see how all these different types of beneficial bacteria are doing in the adult gut. And good news is we have nice levels of Akkermansia, which is related to metabolic health. We have normal range Faecalibacterium, which is just a keystone type of bacteria that's really good at keeping things anti-inflammatory. However, we do see that bifidobacterium is lower than ideal. And if we click into this, we can see it is present. However, it's at lower than ideal ranges. Now, if you've watched the baby gut health test video, you already know that these are very important to pass on to baby. You'll also notice that these ranges of what the ideal level is significantly lower than in babies, which is 80% of the microbiome. So that's one of the amazing things about Tiny Health is not only are you getting a test using the most up-to-date technology, you can also have confidence knowing that you're getting insights that are specifically tailored for the age at which you are testing. And so we see here that this is a metric that we are going to want to focus on for this individual, especially considering that they are pregnant and going to be delivering a baby in the future. So while we don't need to see those baby level of bifidobacterium, we do want to see these come up a bit. And now, even if you're not planning on having a vaginal delivery, we know that all those snuggles the first year of life, if you're breastfeeding, the microbiome of other family members in the household, family members share microbes. Seeding through vaginal delivery is a great way to get those colonized. However, also close contact can also help boost those microbes. So it's really important, regardless of your delivery plan, to have these bifidobacterium, especially in mom. So the good news is that even though the bifidobacterium are slightly lower than ideal, we do see that most of the ones that are there are, in fact, these HMO digesting species, which, again, if you've watched the baby microbiome video, you know that the HMO digesting bifidobacterium are the ones that are going to eat the human milk oligosaccharides, HMOs, which are beneficial sugars found in breast milk, and they use those to help build strong gut linings and a strong immune system. All right, so what else do I like to check in on when I'm looking to see if the microbiome is doing all the good functions that it should be doing? Next, I like to look at digestion and absorption markers. These are more incredible insights that we can only glean with shotgun metagenomics. And I'm going to bet that you all have heard that eating more plants is better for your gut health. But do you know which plants? Because there are so many of them at the grocery store. How do you know which ones to get? If you're eating enough, what is the right type? Well, Tiny Health is going to take that guesswork out for you because we have lots of different insights specifically related to the types of fiber that your gut needs the most help with, or the complex sugars. Or even if we go back, we can see which short chain fatty acids may even need support, which can be done from a dietary perspective. Now, this person we see has pretty darn good digestive capacity. And again, this is one of these really cool insights that's based on the function of the microbiome. So we're not looking for specific microbes that are known to do these functions. We're just looking at the genetic capacity of all the microbes to do these functions. So overall, this person has likely a very good diet and is able to digest a lot of different types of complex sugars, fibers, and produce short chain fatty acids. We do see here that they have a slightly higher than ideal protein breakdown happening in the large intestine. That's a job for the small intestine. So a recommendation we do have here is considering boosting certain types of fiber to help offload that job on the large intestine microbiome. All right, so this person gets a pretty good score overall for the good things their microbiome should be doing, with the exception of needing to boost bifidobacterium, especially considering that they are pregnant and getting ready to seed their baby during delivery. All right, the next area I like to focus on is if there are unfriendly or disruptive or frankly bad things in the microbiome that shouldn't be there or they're at levels higher than ideal. So the first thing I like to do is check in on disruptive microbes. Now, here we can see if there are unfriendly bacteria elevated above ideal levels. And we do see that Enterococcus faecium is above the ideal range. And the good thing is that for anything that is flagged as needing support, we will have related actions for people to consider taking to help address this area of imbalance. And in this case, there are specific antimicrobial spices that can be used to help reduce this enterococcus. And we have this nifty chart that shows you the different types of spices that can be helpful for gently reducing different types of unfriendly disruptive microbes. And we can peruse through here. There's a couple other insights. There's not a lot of antibiotic resistant microbes. There's not a lot of different species, and we don't detect any parasites or infection. And methane producers are in check. Although detected, they are in check. All right, the second area I like to look to see if the microbiome is keeping the bad things in check is the gut inflammation markers. Now, these are different indexes that are very interesting because indexes are insights that look at not only abundance, but also at function. So here we can look to see how many microbes are the species that are known to be LPS producers. And it also takes into account the number of genes detected that produce LPS. These are calculated together to make a score. 10 means average. That's going to be your total normal. So this person, despite having enterococcus that is slightly elevated above ideal, we can see that their hexa-LPS index, mucus degradation index, and hydrogen sulfide index are all within normal range, suggesting that the gut lining is not experiencing a lot of damage. So this is our third type of insight. We have abundance, function, index that takes into consideration both of those things. All right, now lastly, for those who are pregnant or trying to conceive, we do have a condition signature for gestational diabetes mellitus. Again, this is a multifactorial condition. However, the gut microbiome can play a role in contributing to the risk of developing this condition. And we can see this signature is made up of a collection of microbes that are weighted differently based on research and how significant of a role they play in their contribution to the development of this condition. So we can see here there's microbes associated with decreased risk, increased risk, and each of these can be weighted differently based on the role that they play. So this is our fourth type of insight: abundance, function, index that takes abundance and function into consideration, and lastly, signatures, which are taking abundances and weighting them differently to create a signature. Four different types of insights to provide you with the most detailed insights to microbiome health with the most specific recommended actions. Now, I will highlight that Tiny Health is not a diagnostic test, nor does it provide therapeutic interventions. However, it does provide incredibly accurate insights tailored to those who are pregnant or trying to conceive, or really any other phase, stage, or age of life. But specifically, those populations know that they can come and get recommendations that are suited for pregnancy or trying to conceive. Now, we do recommend for everybody, especially those who are pregnant or trying to conceive, to work with their healthcare provider, as well as Tiny Health testing on areas that could use support. Or even better, you can consider working with a practitioner who is familiar with and uses Tiny Health testing in their practice. We have a practitioner program where we train people to become familiar with our tests. So feel free to send your practitioners our way. All right, lastly, if we click into the action plan, we can see all the recommendations for this individual listed here to help with the good things that the microbiome should be doing and to keep the bad things in check that we don't want to see. So we see dietary recommendations, we see probiotic recommendations, as well as prebiotic recommendations to help optimize mom's microbiome, not only for her own health, but also increasing the likelihood of beneficial seeding in baby during delivery. In addition, we offer lots of educational resources and information for supporting your family during all the things life throw at you. During pregnancy, we have information on probiotics that can help with mastitis, on improving iron uptake. We have information on supporting your baby's microbiome after delivery, especially if they may need a C-section delivery. Any topic you can think of, we probably have educational information on it. And if we don't, shoot us a message and we will make sure to look into it. Now, I want to leave you on a positive note. Now, this is overall a pretty good microbiome, but it gets even better. If we go to the next gut health sample, we can see that within only 10 weeks, with the use of a bifidobacterium probiotic recommended by Tiny Health, Maria was able to increase her bifidobacterium levels into the yellow zone. Now, it usually takes 3 to 4 months, or we recommend 3 to 4 months in between sampling for adults to shift their microbiome. And here, after just 10 weeks, we see a shift in the positive direction. So ideally, with continued supplementation, she will likely to continue to increase her levels and increase the likelihood of seeding beneficial microbes into baby.